Okay, PowerPoint 1.4. The three things an office needs to convey to a patient. So, we're going to talk a little bit more about our office in particular, but you should always focus with staff. If this is another office person listening to this video, you should look through things as what would be your three things in an office to convey and what does it convey to the patient. There's always just a few things that stand out above all, and unless you work on them, they will not be available to the patient to recognize. They might recognize other things that you may not want them to recognize, which leads us into the idea of brand and what it says. Now, branding is not just a symbol, and I'm sure all of you recognize these symbols here and what their associated companies are. But if you know each of these as well and you've visited any of these outlets or stores, you would know right off the bat, even if you were blindfolded, you would know which store you were in. I guarantee it. You would know from the smell and the sound or the feel. There's a certain feel with things. And if you think about that, that means that somebody spent a lot of time, and these companies have spent a lot of money building the way Target works. When you walk into a Target, they want to convey something different than, let's say, a competitor like Walmart or the Apple Store. Why does the Apple Store feel like something fresh, transparent, new, or in flashy or expensive? It's because they're not the Best Buy or the Fry's Electronics. They want to convey the information or their product through their store, and so when you walk in there, you feel the Apple brand. Starbucks as well. Starbucks is looking at it as, hey, we want you to hang out here. So the colors and the tones and the visuals all are trying to make it a little more comfortable, but they don't want you to lounge and be sloppy. They want you to be hanging out, spend a little time, comfortable enough to have a casual professional meeting or just a casual hangout with you and your friends. They're very deliberate, they're very professional, and one of the coolest things that I love to see is how these stores change over time. They do change over time. Starbucks has gone through a full renovation inside. The Target near us right now is completely getting torn apart and redone. And that just tells me that they care that much about how it feels inside the store, not just the items that they sell, but how you experience it in all senses of experience of a store. And that's really important. I think that's really, really important because most things are not said and most things are felt, especially when patients come to a dental office, which, a dental office isn't exactly the first place people want to go to just go hang out, nor really shop for either. So what is your office saying without you saying it is the point here. In our office, we want our patients to feel and sense that our office has these three things, that they're clean, comfortable, and affordable. Now, I'm not interested in being the most expensive dental office, nor would I want to personally go to the most expensive. I personally would not like to go to the most expensive dental office. And I feel most people are that way. Most people don't have expendable cash nor have dental savings accounts to want to even spend money on dentistry. So I think affordability isn't just trying to be affordable or want to be cheap, but it's something that I think, the psyche of people just in a general sense don't want to spend money. So when you walk in, I don't necessarily want to convey in my office that it is some big expensive place and that you're going to be spending a lot of money here. I think that is a valid brand for sure. There's no doubt about it, because if you're expecting to walk in the door and you set it up that this is important, this is valuable, I think that's really, really important. And if you want to convey that, yes, it's going to cost you money coming in the door here. It's going to be expensive. This is expensive furniture. It's expensive lighting. Yes, it's going to be expensive here, but the next thing you have to sell is, damn, that value is going to have to be very high and a little bit higher, in my opinion. But you never know. Everybody thinks differently, and I think there's many stripes and polka dots that you can paint your walls and interior and make it look and feel a different ways, so many different ways. I see dental offices reflecting the ownership of the office, and that doesn't necessarily mean that it's the doctor. Sometimes the front staff really take charge of what the actual ownership of that office actually conveys. So what does clean mean to us? This means that keeping all areas the patient goes clean and organized, and for that matter, all places where patients do not go should also be clean and organized as well. So I just always have a lot of things going on, so it's a little bit more difficult because things pile up real fast and I don't have enough time to tend to all things. Stereo wipes, Pyrex wipes always be available. Vacuum the hallway. Clean each operatory. There's a list on our wall when you walk in each operatory explaining the startup of the day and the breakdown of the day. So please take a look at that. We also have a office manual to explain those things as well. We must keep the bathroom clean, stocked, and organized. Nothing more annoying when a bathroom is not properly stocked or that the bathroom is totally messy. That just does not work in a dental office, no matter which dental office you are. I think they should all do that. Definitely keep the lab as clean as possible. There's always work going on in the lab, in the wet lab, pouring up stone and grinding stone, but definitely try to keep that clean. So what does comfortable mean for us in our office? First things first, it's definitely listen first, then ask questions and start asking and providing information. In the operatories, set the headrest. Does the patient need a pillow? You can always ask these things. It's free to ask. Appropriate music that's going on in the room. Please don't put the music on that you want to hear as much as ask the patient what type of music or things that they would like to hear. And some patients don't want to hear any music, so that would be totally fine. Maybe we put on the radio or maybe we just turn everything off. Conversation is a must in a dental office, in my opinion. And yes, this does help people become more comfortable. When people know who you are, when people hear you speak, when people communicate, they connect. And when they connect, they just feel more at ease. And that's just human nature. So we want people to come into a dental office. They always have anxiety. They always are worried. We do a lot of surgeries. So the easiest thing you can do is just start up a conversation, and we'll talk more about conversation starters and things like that and how to convey that later on, but you get the idea here. Insurance is kind of funny because it gets uncomfortable talking about financials. Insurance always comes up. We don't take a huge amount of insurance, but the idea with insurance is you can always get back to the conversation with insurance. Why? Because the insurance company is not in the office. So if a conversation is going downhill or is getting heated in any way where voices are rising, just refer to the dental insurance company and that you will get back to the patient and then we'll sort it out later. Much better to get somebody that's becoming deregulated to become more regulated when we have more control over the situation. So that's why I put that in there. It's kind of a funny, comfortable thing that our office would do. But like I said, we don't do a lot of insurance stuff. but we also want to make sure that we have all the information available to them. So what does affordable mean here? So affordable, just for a staffing point of view, we want to not be throwing things away all the time. So I try to buy things that we can sterilize and keep in the operatories. We want to discuss treatment value to the patient. So a lot of things that we do have discounted pricing to them, and certainly discounted more than what the average would normally be, because that's what I like to provide to the patient. So when you increase the value, the affordability becomes better and better, right? It's the same thing as lowering a price. So we always want to try to increase the value, and this is more directed towards the front staff, is increasing value, showing a patient or discussing what the actual fees would normally be, kind of like the MSRP pricing on an automobile. You almost inherently know you're not going to spend that. So sometimes we give discounts with complete payments or senior discounts and things like that. So those are always value adds. But you have to come from a point of view that's a lot higher to create the value adds of complete payment discounts or some sort of senior discounts. I do some pro bono work. So some things I don't always include, or I don't think it's fair to bill entire amounts for. So for instance, what I do is I commonly do not charge anything really extra for a temporary stay plate while somebody's in a healing position. What I do charge is just the laboratory fee. So that's a courtesy, and that's technically pro bono. Patient covers the lab fee, and I do the work for free. So here we also add value by talking and reiterating and making sure the patients understand what our remake or warranty policies are for the office. So a couple important things to know today is how can we make our treatments more affordable. That doesn't mean lowering the price, but it also means increasing the value. What exactly does clean mean to us in our office? And look at our notes for that, as well as please make suggestions for our office and make it feel a little bit more branded without speaking. Thanks.